All right, peace be to you all. Assalamualaikum. Omar here. I wanted to use this opportunity to give some advice, some nasiha to you pre-PA students and you pre-med students also, that when you get into your different programs, to always remember to do a very thorough physical exam on your patients when you start your rotations. In particular, internal medicine and surgery. I did something very naughty when I was a PA student. I was doing my surgical rotation. The surgical rotations are anywhere from 4 to 6 weeks, depending on the program. And sometimes you will be assigned patients. So those patients are your responsibility. Rotations are very, very intense, and sometimes your day may start very early and it may end very late. So you're going to be very tired, especially if you're on call. So with my surgical rotation, we started our rounds, I think it was 6 a.m. and didn't end till 6 p.m. We did the end round. Well, we started rounds at 6 a.m. and then you had the rest of the day to see other patients and go to learning activities, go to codes if one should arise, and then scrub in and go and scrub into surgeries. And then after that, at the end of the day, you do another set of rounds to check on your patients for follow-ups. Well, in the beginning, it's very harrowing if you're not used to doing very in-depth physicals on patients. By the time you start your rotations, you should be pretty adept at doing in-depth physicals on patients. One of the things that you want to do is be very accurate in your presentation. So I did something that was very naughty. I showed up to the hospital. This is a DC General Hospital at about 5 o'clock in the morning because I had been assigned, I think it was 3 patients. I knew we had to start our rounds at 6 a.m. So I wanted to be prepared. So I examined my patients, but I was also looking for their lab results from the previous night, their I's and O's, so that's intakes and output. So in terms of fluids in particular, so how much fluid did they get? Any boluses of fluids? How much did they urinate? One of the things that you got to know is if your patient has a Foley catheter, sometimes called an indwelling catheter, or a condom catheter, sometimes called a Texas catheter, or a suprapubic catheter. That's a tube that goes directly into the bladder. Or if they have no catheter at all. You have to know these things. Or if they don't, if they're somebody who is anuric, so they don't produce any urine. These are usually dialysis patients. You need to know this, and you need to be able to report this accurate. Me, got to my last patient, I was rushing, and our chief resident would like just yell at us and fuss us out if we were late, if we were literally 30 seconds or a minute late to rounds. So I just looked at this patient, listened to his lungs real quick, and then I saw that he had a tube coming from under the cover. So I was like, okay, he's got a catheter. I didn't check what kind of catheter it was. So of course, of all things for my chief resident to ask me as we're doing rounds, and as PA students and med students, you're gonna, depending on the program in which you attend, you may do your clerkships or rotations together. So I was there with the PA students and the med students. So of course my chief resident says, okay, does that patient have an indwelling catheter or a condom catheter? I says, dang, I didn't check. I didn't say that to her. I should have said that to her. I said, doctor, I apologize. I did not check. I know the patient has a catheter of some kind, but I didn't check. I have no excuse. I apologize. It won't happen again. I said, okay, I have a 50% chance of getting this right. So I said, well, it's an indwelling catheter. So, of course, when we pulled back the guy's blanket, as I should have done, it was the condom catheter. He says, does that look like an indwelling catheter to you? I said, no, doctor. So, yeah, I just proved myself to be a liar and be a practitioner of sloppy medicine. So that stuck with me. That was more than 20 years ago. 23 years ago, to be exact. I never forgot that, and it haunts me to this day. 23 years later, it haunts me. So I'm sure to check my patients very thoroughly. Some of the patients, if they're alert and oriented ×3, they're very impressed by that. They're like, wow, you listen to my lungs and check me out and everything. Especially if the family members of the patients are watching. You really do a good, thorough job. I say, yeah, because I don't want to have happen what happened to me, years ago. If the attending asked me a question, as a PA, the attending really relies on me to give them good, accurate information about the patients. And then, when I'm talking to the patient's family members, I've got to give them good, accurate information as well. So doing a good, thorough physical is a key component of that. You can do more focused, less thorough physicals once you become very familiar with the patient. But that's it for now. Remember, when you're initially seeing your patient for the first time, do a good, thorough physical exam and report so you can report your information accurately. Okay, that's it for now. I wish you guys the best of success in your positive endeavors. If you are a PA student or a PA student who wants some advice, I'll be happy to mentor you to the best of my ability. Take care. You can reach me on Instagram or via email. See ya. Peace.